Here we see how the finished crowns are fitted on the implants, and we see that there is a perfect fit. There is no friction whatsoever. When the patient bites down lightly, we want contact with the natural teeth, but the indicator foil should not be retained in the implant region because the implants are not intruded. We can just about pull the foil through. Only when the patient bites down hard can the foil be retained because the natural teeth get intruded. This is very important because otherwise the implants would already be loaded even with a light bite. So this would be too much contact. As I explained earlier in the video on making provisional restorations and impressions, we apply ketak to the final restorations. Final cementing will be done with a glass ionomer cement, the cement produced by Voko or ketak produced by Espe. We push down hard once to reduce the excess cement as much as possible. We then keep on holding the restoration only lightly to avoid cementing any tension into the structure. As is the case with removing Duralon, we wait for the glass ionomer cement or ketak to become viscous so that we can remove it, if possible, in one piece with a scaler. We then apply dental floss once to ensure no cement debris are left in the interdental space. Then we use the indicator foil again to check whether the foil can be removed with a light bite and is retained on the implant with a strong bite. Here we see the X-ray with the final restoration after prosthetic treatment.